Welcome everyone to the practitioners call. So excited to have each and every one who jumped on today or will be jumping on with the replay. Welcome, welcome, welcome. Our doctors are in the house. Dr. Tim, Dr. J, Dr. Don are here, and they're going to be sharing some very important information about pain and inflammation today. Um, as always, though, we are all doctors of some sort. We help people spiritually, physically, mentally, emotionally, in every way possible. Chiropractors adjusting, doing nutritional protocols, and helping people to live the very best life. But we're not your medical doctor. We don't offer medical advice. If you need medical advice, you need to go to your medical practitioner for that. And that includes anybody that's nursing, pregnant, nursing, that type of stuff. And we are all independent LifeWave brand partners, so we do not offer or represent the company. We are just offering educational information here today that we hope will truly help each and every one of you. So with that, we are going to talk about inflammation and pain because, inflammation is a very real thing. Number one, it's necessary for healing whenever you get hurt. Inflammation is going to go to the place where you're hurt, whether you're cut or bruised, damaged, or whatever. But in the a case of inflammation gets out of hand, it becomes what we call chronic inflammation, which lays the foundation for all kinds of sickness and disease, pain, suffering, because inflammation is, again, your body's inflamed, it's being overheated, and it can create all kinds of challenges. And I know my chiropractors are going to share with you today because they run into this every day in their practices. So let's start off today with Dr. J. What about pain and inflammation, brother?
Hi, y'all. I'm Dr. Jay Reister from Kent City, Michigan, practicing for 23, 24 years now. Great topic. I think the stem cell activating patch technology that we have goes right in line with our profession. We deal with patients having all sorts of ailments and accidents and injuries, and when you have inflammation, like Dr. Stan just mentioned, that's an important part of the healing process. But when it becomes chronic, that's when it's like chain reaction. Like you get one area that's inflamed because of another area that's inflamed, and then so on and so on and so on. And inflammation is the cause or promoter of just about every disease process we have. So getting the inflammation under control is important. Jody, a few minutes ago, reminded me of one of my grandiosest, if I just made up a word, success stories with these patches. I've had Glenn and his wife Barb as patients for about 8, 9 years. And they both suffered with chronic inflammation because of a very severe motorcycle accident they had about 13 years ago. They were both on their own bikes, and it was about 9 o'clock at night in the summertime, just dark enough to where you couldn't see everything. So there was a car deer accident in front of them on a country road, and they did not see the deer nor the car. And he was in the front side. He was in the front. His bike belly jumped the deer, and he ended up into her lane, and she pile drived him into the car. They were both pronounced dead at the scene. He had 57 broken bones and 3 punctured organs. She was also quite terrible. But I remember his injuries just because there was just, it's an amazing amount of body mutilation, to be honest with you, but dead at the scene. Both of them, they got revived, and Glenn, it took him 2.5 years to be able to just go back to work. And when he was able to go back to work, he was still in severe pain daily. I mean, pain was part of his life from this point. And I didn't know this until after, but he was only sleeping an hour and a half at a time. He could not get a good night's sleep. Sometimes he could get back to sleep after 90 minutes. Sometimes it would take him a couple hours to get back to sleep after 90 minutes. It was just miserable. Um, I've been treating them chiropractically. I think I came into their lives about 5 years after the accident, so I've been treating them for 7, 8 years now. Um, and Barb was doing very, very well. Glenn, though, he was never the patient that as soon as we got done with adjustment, he hugged me and said, "Oh my gosh, I feel so much better." I knew I was helping him, but the level of pain relief wasn't all that visible. And I'm assuming I was giving him a 20 to 30% pain relief. And he kept coming back at least once a week, usually twice, for a very long time. And this patch technology came into my life, and I started sharing it with patients because my shoulder pain after 5 years faded away, which is my own little personal story. But Glenn is pretty remarkable. So anyway, I introduced the technology to both Barb and Glenn, and then Barb comes back in a couple weeks and says, "Yes, we need to do this. Glenn needs these so bad." And so we got him ordered up. We put him on the X39, which is stem cell activating, and the Eon is the decrease of inflammation. And I saw them. We were doing a big meeting at a church in Rockford, and Dr. Don and Susan asked me to stand up and say a few words, and I did. I do have a great little story with my daughter, but that wasn't really enough for me to jump on stage, in my opinion. But before the meeting got started, Glenn and Barb walked up to me, and I'm like, "What are you guys doing here?" And Glenn looked at me and he said, "Doc, I did not know what to expect with these patches, but I've been pain free for 7 days." And I thought to myself, "That's impossible because you basically just got them." He's like, "Yep, I got them 10 days ago. And after the third day, I was pain free." And this is a guy in my office that I knew I was doing the best I could for in helping him. But he wasn't pain free for the 7 years that I was working with him. So having that happen so early in my relationship with the LifeWave technology, well, it really got me super excited and sharing them with everybody. Unfortunately, not everybody's going to have that kind of immediate. We call that a one patch wonder, and some of the other guys might have a few examples. I'm sure they do. But Glenn was my first one patch wonder, and it was profound, an amazing improvement on his quality of life. Like I said, he could only sleep 90 minutes at a time, and in pain. He worked, he works in the tree service, and that's a physical job. And he's a little bit older than me. He's probably about 60. Um, so having that guy with that kind of response, and I've known him for quite a long time. Like I said, I was treating him for 7, 8 years before I introduced the patches to him. And that's just a remarkable improvement on his pain levels. I mean, he gets adjusted frequently still, once or twice a month, just to make sure his body's all in line. But he's not coming in pain anymore. So that's a huge blessing and a very impressive testimonial for the quality of the product and proof that the science is solid. I hear this a lot, and I like to say it. The patches are not on trial. They've got over 80, probably 100 clinical studies by now, peer reviewed, rock solid science. One of the patents on the X39, the stem cell patch, is a 20-year global patent, and you do not get 20-year global patent without rock solid science proving that what you say this technology is going to do, it's going to do. So they don't give those patents away. That is, it's just pretty impressive. I'm happy that it was introduced to me almost a couple of years ago. My wife and I and my special needs daughter are using the patches every day. My other two kids get our used ones. They're not too excited about that, but I just make them do it because I love them. But yeah, I could talk about this stuff all day, but it's already been enough time for me to listen to the other wonderful docs and my colleagues. So, um, yeah, I'm glad you guys are here. I'm glad you guys are listening. If you're new to the technology, you got to put it on your body to make your body change in a positive way. I'm pretty strict with my patients on what to expect. If you're a young kid, 15 to 25 years old, and if you got issues, you're going to want to give it 6 months. In fact, if you're 20 to 40 years old, I tell my patients, leave it on for 6 months. If you're 41 to 65, give it a shot for 9 months. Everybody that does it long enough gets what they're looking for. Um, but it is hard. Some people respond really quickly and some people take a long time. So I hate to say it like that, but that's the truth. It's like a bell curve. Some people are fast, some people are really slow, and the rest of us are somewhere in the middle. With that, God bless you all. Thank you.
All right, Dr. Tim, what you got to offer us today?
All right, everybody. Welcome. My name is Dr. Tim Tag of the Tag Team, and I'm a doctor of chiropractic, clinical nutritionist, almost 23 years in practice. And I just noticed a question here from Verita. Talks about, can you talk about which patch helps with tissue repair? Well, I have a testimony, a clinical testimony. I'm going to address that. So I'm going to answer that question. But yeah, I have a few nuggets, and my wife and I, Dr. Kathy, we use the patch technology in the clinic every day. And I'm going to mention four of our most common, like awesome testimonies and breakthroughs in getting rid of inflammation using this patch technology, which uses your own infrared light to bounce back into your body, resulting in a positive physiological, process to health and optimization. But we get a lot of some young teens and children with ear pressure. And most of the time what it is, it's there's inflammation and there's gunk stored up in the ear canal, and those eustachian tubes, they can't properly drain. So what we do is we take the Eon patch, which looks like this, and right behind the ear there's a little bony part. It's called the mastoid process. And what we do is you can take like a paper towel or a rag or a tissue and just make sure there's no wax on that. And on the side of discomfort, place that Eon patch. And usually within minutes, that child will start talking about their hearing popping, but the ear pressure is going down, which is good. And that's the Eon patch. And again, I'm not diagnosing, I'm not treating. I'm just showing how to support the body so it can work at its best with this technology. So that's one of them. And then there's wound healing, kind of like what the Verdita. I'm sorry, Verdita, if I messed up your name, I apologize. But I had a patient, and he had hernia surgery, and he had about an 8-inch incision in his abdomen. And after the surgery, which was successful, but after 6 weeks, it was not healing. It was pussy, it was red, it was inflamed, and it was just it. I mean, obviously, it wasn't like infected though, where he had to go to ER, but it was just he took a picture of it, and I'm like, oh my! I mean, I don't get grossed out, but this picture grossed me out, and I'm trying to get permission to use that. I want to bring that picture to show everybody the before and after. But what we did, we took an X39, which is the cell regeneration patch. And when you put on the X39 and you get those cells regenerating, they go right to cytokines. So as soon as they wake up, because they're in a dormant state, as soon as those regenerative cells wake up from that patch, from that light, that infrared light coming from your body back into it, they go right to cytokines. So if there's like an acute wound, whether it's from falling or a surgery, that's where those cells are going, or those regenerative cells they're going to travel right to that point. So on one side of the wound, we put an X39, and then on the other side, we put an Eon, the AEON, the one I just talked about. And just kind of physiologically thinking, you have this perfect healing cycle going on right around that wound. And folks, after 1 week, he took a picture after 1 week, and the redness was gone, the pus was gone, and there was just a new thin layer of skin. Like it was like the wound healing went into hyperdrive just by those patches. No creams, no additional supplements, just those two patches, X39 on one side, Eon on the other, and it doesn't matter what side. So if you have anybody with a scrape, or they're trying to heal from a surgery, X39 on one side, Eon on the other. And it's like there's surgeries going on every single day in the United States. I mean, really all over the world. But those patches should be used for wound healing because, again, they support the body, and they help the wound heal better and faster. Another one, of course, since we're chiropractors, we get a lot of back pain people, and we've used mostly Ice Wave for back pain. And with the Ice Wave is a two-patch system. Ice Wave has a tan patch, and they have a white patch there. And what you do is with the Ice Wave, you put the tan patch right on the point of pain. And what you do is then you take the white one, and then you almost like a clock. You put the patch, you don't stick it on yet. You just put it right up against the skin. You wait 10 seconds, and then you ask, is it better, same, or worse? And then you keep going around until you find that sweet spot. All right. And when you find that sweet spot, that's where you take it and you patch people up. And with the back pain patients, a lot of times it's like in the lower neck and in the low back, of course. Low back is common. But what the Ice Wave does, it turns off the energy centers. So you don't really, it'll take away the pain, but it doesn't really correct the problem. So you still want to address that. And oftentimes too, we'll take an Eon, the AEON, and I'm sorry, the Eon is it's the inflammation accommodation patch. So whenever you put Eon on something, it's accommodating that inflammatory process, which is essential. So that's for the back pain. And then shooting pain, when people, they get shooting pain down the arms, into the fingers, or even down the legs, if there's no pain like in their spine, what we've been doing in our office with fantastic results is we've been taking the tan patch and we've been putting it on the liver. And then we take the white patch and we put it directly behind on the back. And most of the time, folks, it'll shut off that pain, that the shooting pain. It's amazing. And sometimes if that doesn't shut it off, you bring the tan patch back and you bring it right up below the clavicle. And then you have the tan patch below the clavicle, and then you take the white patch, you put it right behind it on the back. One of those two spots will usually get rid of that shooting pain. There's something about the liver. Because like Dr. J said, folks, inflammation is one of the most common problems of most health issues. When our body can't get rid of inflammation, it just culminates into other problems. It's unfortunate. And one of the best things you can do with patching is to intermittent fast. Intermittent fasting is where you don't eat 16 hours out of your day. You only eat like 8 hours, and try to do that like at least once a week, because we need to get rid of that inflammation. So with the patch technology of those regenerative cells, chasing those cytokines and healing that tissue or the cells, and then you got the Eon and that inflammation accommodation. That's where you get this optimized health and optimized support. And all with this patch technology, using your own light, or I like to use the word biophotons. Don't let your biophotons go to waste. So those are my 4 nuggets. And
All right.
I think I'm going to hand it off to Dr. Don.
Unmute myself.
There you
I'll
go.
unmute myself because sometimes my dog is causing problems. But it's good to be here. And one thing is, over 50 million people in the United States deal with pain and inflammation. If we look at the world stage, it's about 1.5 billion people who live with chronic pain. And I was looking at stats earlier. In 2021, 80,000 people died from narcotic overdoses. And most of those people were taking that for pain, and then it turned into an addiction. And we've heard countless stories of people. I've got patients and friends. One has a son that died from a fentanyl overdose. And so it makes me want to like offer any solution. And I've loved the patches. They've talked about several of them. The X39, the Eon are the two power hitters. Also, X49 synergistically can work with X39, especially with our athletes. We'll put those two together. So if they injure their knee, I'll have them put one on each side of the knee. And sometimes I'll even have them put an Eon down there by the knee as well. Or if it was a shoulder, we could do the same thing. The nice thing about those three patches is we're going to reduce inflammation, help the muscle to rebuild. Now, it's going to help an athlete to just build muscle and tissue anyways. But when you've injured it, it's even more important to have those, that AHK copper peptide floating around so the muscle can regenerate at a faster rate. One other patch is the glutathione. We know inflammation is the core of every disease. It's of every pain. People with sinus headaches, they're all inflamed in their sinuses, and they're probably toxic from either foods they eat or different things. And so I have found, yeah, glutathione will reduce that inflammation and that toxicity that's in their body. And whenever you lower that, you're going to help reduce pain throughout the whole body. As Dr. Tim said, you know, diet plays such a huge role, or even stress, the stress of tough relationships. You know, our suicide rates in the country are at the highest they've ever been. People's anxiety levels are high, and that's where the Eon can help. And anything we can do to lower cortisol and lower stress is going to help so many people. And of course, Dr. Tim mentioned Ice Wave. We use that quite a bit. I've had several stories, and it's usually patients. One had just come out of a knee surgery months earlier, but because they did a release of one of her muscles around her knee, she had ongoing pain at the site of that muscle release and could not find any way to get rid of that. And so I took the brown patch and I put it right on the spot where she is having the most pain. We floated it around that 12 o'clock, 3 o'clock clock pattern to 6 o'clock, and we found a spot, and all of a sudden she went, her eyes just about bugged out of her head, and she goes, "What did you do to me?" She goes, "I can't believe I've had pain every moment for months." And she goes, "It's gone. This is miraculous." And I've had stories with patients with back pain. Similarly, he had gone through care, improved 80, 90%, but he was still having this residual back pain and he could only bend like halfway, and then he'd get some jabbing pain. Well, we put that Ice Wave on him around the back area, and he bent forward, and in 10 seconds, he touched his toes, and he goes, "Oh my word, this is miraculous." And so now he's jumping into X39 and Eon. And that, you know, that was a young guy that's dealt with this severe sciatica and pain for 2 or 3 years, I think it was. And so there's lots of great stories. And of course, if people have structural problems, if they've lost the curve in their neck or they've got a big old hunchback, those are going to lead to ongoing problems biomechanically. And we certainly want to address those. But on the flip side, many times people have tried even all the natural alternatives. They're still having pain. And these patches can help in so many unique and different ways. Otherwise, I think that's most of what I was hoping to cover and help people with. I'll take a peek and see if we have any questions out there. I see plantar fasciitis. Again, I think I'd find the most painful part of that plantar fascia and then try either floating it around or and see what spot with the white patch would help that person. And I also see some questions about circulation and Raynaud's. And of course, we're not seeking to cure any disease by this advice, but it's something you can certainly try. Carnosine helps to improve circulation. Personally, I would probably put an Eon and carnosine near the site of the Raynaud's. Some people will get it in both hands. Some people have it more predominant on one. But carnosine is, again, going to improve circulation, and the Eon and X39 in time, we would be hoping that would help. Look. And somebody else asked about surgeries around the mouth. You could certainly, because there's epithelial tissue lining our entire gut. Externally here, Alavita patches. You could also wear and we wear those at night. They're a nighttime patch. They can boost melatonin in the body and help you to relax and fall asleep. But at the same time, they help to rebuild skin and tissue in their own unique way. And so we use that quite a bit in our practice as well. But with that, I think I'll pass it back to Dr. Stan or whoever else is.
All right, guys. We just got some great testimonies and some great tips from our doctors. And I think what we always tell people when it comes to pain and inflammation, obviously IceWave is your go-to for immediate pain relief. Instead of grabbing the Tylenol or the ibuprofen, you grab the IceWave. Jody and I are getting ready to do a big festival, and we have a sign that says "Got Pain," and we have seen literally hundreds of people leave our booth pain-free by just putting the IceWave on their body. Then, of course, we got to address the issue internally. So X39 and Eon are your two go-to patches for healing, restoration, rejuvenation, getting inflammation out of the body. And as Dr. Don said, we're not prescribing or diagnosing or treating. We're just assisting your body to elevate its own peptides to heal itself. It's just that simple. Your body will heal itself if it's given the proper fuel, so to speak, the proper tools, the proper technology. And then we've heard two other patches. Glutathione is another great patch for inflammation because it's an antioxidant. It also helps with pain control. And I personally have seen people use X39 and glutathione around their knee and eliminate pain that way without even using the Eon. So Eon is your number one go-to anti-inflammatory patch. Glutathione is your master antioxidant, but it will help with inflammation and even help some with the pain. And of course, carnosine is another one. And Alavita, will close with this. As far as the face and mouth, I had this place that kept coming up on my cheek the last couple of years, and I didn't know I didn't really think it was cancerous or not, but I would put ointments on it and everything. So at the last week or two, I've been patching Alavita right over here on my face, and it's totally gone. Everything has disappeared. Everything is healed because it is a powerful. I've heard David Smith say it's the second most powerful patch we have in the arsenal. There's so many things we could keep going on here with today and answer questions, but doctors have got to get back to their practices. Jody and I have got appointments to go to. The replay will go on my page, LifeWave Living, with Dr. Stanley Gravely, but also the other practitioners will get copies of it so they can send it to their constituents for replay purposes. But thanks, guys. A lot of good information. What great testimonies today of what this technology is doing. to eliminate pain and all the aches and pains of life and sicknesses and diseases without having to use medical intervention, drugs or pharmaceuticals, all natural, safe, and you don't have to worry about the technology interfering with anything going on in your life that your doctor's doing. But as always, consult your doctor if you have a medical concern. Thanks, guys. Appreciate it. We'll be back in 2 weeks. Thanks, docs.